Congratulations, you just found out you're pregnant. As a first-time mum, you probably have a lot of questions. Today, we're diving into everything you need to know during the first month of pregnancy. Let's get started. What is happening in my body during the first month of pregnancy? Right now, your baby is called a zygote, a tiny cluster of cells making its way down your fallopian tube. By the end of this month, the zygote will be about the size of a poppy seed. This tiny zygote is the very beginning of your little one. The neural tube is forming, which will become the brain and spinal cord. The placenta, which will provide nutrients and oxygen throughout the pregnancy, is also starting to take shape. What symptoms should I expect during the first month? Some common symptoms include a missed period, tender breasts, fatigue, nausea, and frequent urination. Every pregnancy is different. Some of these symptoms may be mild, while others may not happen at all. It's normal to feel tired. Your body is working hard. To combat fatigue, make sure you get enough rest and listen to your body. Prioritizing sleep and relaxation can help you manage the physical demands of early pregnancy. When should I schedule my first doctor's appointment? It's essential to schedule your first prenatal appointment as soon as you find out you're pregnant, ideally within the first 6 to 8 weeks. During this visit, your doctor will confirm your pregnancy. The EDD helps your doctor track your baby's growth, schedule tests, and monitor the progress of your pregnancy. Knowing your estimated due date is crucial for planning and ensuring you receive the appropriate prenatal care. What type of exercise is best during the first month? Light activity is great during the first month. Walking is perfect. It's low impact and keeps you active. Prenatal yoga is also a good choice. It helps you relax and stay flexible. Staying active can help manage fatigue and reduce stress. The goal is to feel good, not to push your limits. Always listen to your body and consult your healthcare provider before starting any new exercise routine. What lifestyle changes should I make during this time? Eating well is crucial. Take a prenatal vitamin that includes folic acid to support your baby's development. Include a mix of fruits, vegetables, whole grains, and lean proteins in your diet. There are a few things to avoid. Stay away from alcohol, smoking, and any recreational drugs. Limit caffeine to less than 200 milligrams a day, which is about 1 12-ounce cup of coffee. Also, avoid raw or undercooked meat and unpasteurized dairy products. What can my partner do to help during the first month? Your partner can help by taking on household chores, providing emotional support, and attending doctor's appointments. Pregnancy is a team effort, and support makes all the difference. When should I contact my doctor immediately? Watch out for heavy bleeding, severe abdominal pain, fever over 100.4 degrees Fahrenheit, severe nausea with inability to keep fluids down, or sudden dizziness. Contact your doctor right away if you experience any of these symptoms. How can I take care of my mental health during pregnancy? Pregnancy can bring a roller coaster of emotions. Taking time for yourself, practicing meditation, or talking to someone you trust can help you stay balanced. Remember, your mental health is just as important. The first month of pregnancy is full of new experiences. There's a lot to take in, but you've got this. Your healthcare team is here to help you every step of the way. Stay informed and take care of yourself. Thank you for joining us today. If you found this video helpful, give it a thumbs up and subscribe for more content about your pregnancy journey. Leave us a comment if you have any questions and we'll be happy to help. During the first month, your body undergoes significant changes. Hormones are adjusting, and your body is preparing to nurture new life. Understanding these changes can help you feel more in control and prepared for the journey ahead. It's important to maintain a balanced diet and stay hydrated. Your nutritional needs are changing, and providing your body with the right nutrients supports both your health and your baby's development. Consider consulting a nutritionist for personalized advice. Emotional support from friends and family can be invaluable. Sharing your experiences and feelings with loved ones can help alleviate stress and anxiety. Building a support network early on can make a significant difference throughout your pregnancy. As your pregnancy progresses, you'll notice changes in your body and emotions. It's normal to feel a mix of excitement and apprehension. Embrace these feelings and remember that each pregnancy is unique, with its own set of challenges and joys. Staying informed about your pregnancy can empower you to make the best decisions for your health and your baby's well-being. Consider joining prenatal classes or online forums to connect with other expectant parents and share experiences. Your healthcare provider is your best resource for any questions or concerns. Regular checkups and open communication with your doctor ensure that you receive the care and guidance needed for a healthy pregnancy. Don't hesitate to reach out for support. As you embark on this incredible journey, remember to take things one day at a time. Celebrate the small milestones and cherish the moments of joy. Your journey to parenthood is unique and special, and you're doing an amazing job.